Good day, I am Juliane Gregorio from Nueva Ecija University of Science and Technology College of Nursing. And for today's video, I will be doing blood typing. And for the assessment, the knowledge of the client about his or her blood type, the client's understanding of the procedure, the client's skin at the puncture site determine if it is intact and if there is circulation is compromised. And for the planning, prepare all the equipments needed, the CHN OB pad. And for the other equipments, capillary tube, it is optional. Blood grouping, antisera, A and B reagent, paper towel, antiseptic swab, disposable gloves, sterile lancet injector, it is optional. 2x2 sterile gauze or cotton balls. Clean wooden stick, 1 glass line. Good day, sir. My name is Juliane Gregorio from Nueva Ecija University of Science and Technology College of Nursing, and I will be your student nurse for today. May I know your name? Your age?
13.
And your birthday, sir?
August 19, 2007.
Okay, so for today, I will be doing a procedure of collecting a small amount of blood for us to be able to determine your blood type. And with the help of the reagents I have here, blood typing is important because you need to receive the right kind of blood during the surgery or after an intake. If you are given an incompatible blood, it will lead to blood clumping. Before I start, I will prepare the things and perform hand hygiene to ensure that proper infection control procedures and sanitation of the materials are ensured. Can you place your hands here, sir? Perform hand hygiene and observe appropriate infection control procedures. And put some gloves. You can now choose the vascular puncture site. Clean the site with the antiseptic swab and allow it to dry completely. You can massage the puncture site. Prick the site with a lancet or needle using a darting motion. Wipe away the first drop of blood with a cotton ball. Gently squeeze, but do not touch the puncture site until a large drop of blood forms. Place a drop of blood in the glass slide, one on each end. Ask the client to apply pressure on the skin puncture site. A drop of antisera A, color blue, is added over or near the blood on side, and antisera B, color yellow, on the other side of the slide where the second blood is. Also drop a sterile water on the last blood. Mix the blood and antisera using a clean wooden stick, and do not use only one wooden stick for each blood. A little disclaimer, in this video, I use blue and yellow food color due to the absence of the real reagent. The results are read directly from the slide. The subject is blood group A if agglutination occurred with the anti-A test serum. Group B if agglutination occurred with the anti-B test serum. Group AB if agglutination occurred with both test series. And O if there was no agglutination in either case. And for the evaluation, reassess and evaluate the client's comfort after the nursing care. It is essential to tell the client his or her blood type, so when any emergency arises and when transfusing blood requires, they will be able to donate or receive a specific blood component. And last, for the documentation, document the test and the result of the procedure you conducted. Once again, I am Juliane Gregorio from Nueva Ecija University of Science and Technology, College of Nursing. Have a great day!